Good afternoon. We'll call to order the Burleigh County Human Service Zone Board meeting. Today is Tuesday, March 18th, 2025 at 3 p.m. We're in the Tom Baker Room. We will start by doing roll call to members.
Galen Becker.
Here.
Kelly Berglund.
Here.
Tracy Famous.
Here.
Jim Holm.
Here.
And Director Flory.
Here.
And for the record, Commissioner Bakken, Senator Dever, and Trevor Vanette are absent.
Next on the agenda, we'll do the approval of the meeting minutes from the December 17th, 2024 and meeting, the zone board meeting. And then on January 7th, 2025, we had a special meeting regarding, that was an executive session regarding a appeal of a general assistance. So I would take a motion for either one of those individually, or you could motion for to approve both.
Motion to approve both.
Thank you. We have a motion. Do I have a second?
A second.
Okay. So we have a motion and a second on the meeting minutes, so I'll just say all in favor, say aye.
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 Any opposed, same sign. Motion carries. Next up, we'll do the director's report. So today we're going to start with our economic assistance updates. And so I will have our program administrator, Gray, come back up in, again, this meeting that seems to work well, to hear from her about the programs that she's operating.
Hi, good afternoon. So just a quick report here. There are some exciting things that are going to be happening in DHHS. They are going to be holding a spring symposium for economic assistance and Medicaid eligibility. This is going to be on May 13th through the 15th. There is both virtual and in-person events that are being held. The purpose of the spring and symposium is to bring together economic assistance, Medicaid team, and eligibility workers from across the state for learning, sharing, and networking. Excuse me. This is going to be held at the Bismarck Event Center. They are bringing in a couple of keynote speakers. One is Tim Gard, and the other one is Mark Lindquist, as well as Adam Martin from the F5 Project to speak. They're going to be hosting several interactive sessions, such as a poverty simulation experience and a Department of Corrections simulation. Currently, we are working together with our region to determine how many of our eligibility workers would like to attend and how many we can allow to attend to still keep our zone offices open and working. Moving into the programs, as far as the SNAP program goes, I'm going to start with that one. In March of 2024, we had what they called March Madness was implemented due to backlog in work items at the time. There was a big push to get cases worked and benefits to the clients as quickly as possible. At that time, the focus was not on the quality of the work, but on timely benefits to the clients. Also last year, Burleigh County Human Service Zone hosted 2 management evaluation reviews with the Food and Nutrition Services. During these reviews, FNS looked at things like timeliness and processing of applications or reviews, as well as payment and procedural error rates. Quality control and compliance, they are also currently working on a corrective action plan that has not been finalized yet. However, this is going to also focus on application timeliness and payment errors, as these were some of the things that came out in the FNS reports. Some of the things that the state is implementing because of this possible corrective action plan, or the corrective action plan that will be taking place eventually, the state is going to be holding engagement in high efficiency accuracy team visits. They're calling these HEAT visits. They will be throughout the year and around the state. Burleigh Human Service Zone is on schedule for a HEAT visit in September of this year. During these visits, they will be conducting observations, interviews, targeting trainings on various topics, and education on QC measurements while they're here. Also, the state is implementing, beginning April 1st, error proofing of random cases statewide. They plan to randomly select 1% of all the work items that are being created and will be pulled for review by either a lead or a supervisor, and these reviews have to be completed prior to the eligibility worker being able to fully authorize the case. Some of the things that our zone office is going to do is going to be implementing in order for us to also focus on the case errors, the payment errors, and the application timeliness. Supervisors will begin monitoring and using the dashboards that are created for the zone measurements to ensure that all of our team members are meeting the measurements. And supervisors will also be taking a more direct approach and working one-on-one with our own team members for the areas in which they need improvement.
So the only thing, great, if I can add, for context for the board, so when these reviews are completed, there's parts of the reviews that are looking at what are we doing on-site in Burleigh County? Like, do we have the right signage in our lobby? Do they observe interviews that we're, and interactions we're having with our client from my front desk to the eligibility workers meeting with them? But then there are parts of this review that are done with random pulls of work that's being done statewide. So just want this board to keep in mind, this isn't all the performance improvement isn't a direct reflection of just Burleigh County being we process statewide work. So some of it, they could be pulling cases and auditing cases, and that's an error that was in another area of the state. So this is a statewide improvement plan for all zones. There are certain things that, yes, they could say to Burleigh County, like when they observed this interview, these interactions you had. We actually had good feedback on our interviews we're doing and the time that people were taking to explain the process to people and kind of using people-friendly language and not getting caught up in the technical jargon, which was really good feedback. But on the other hand, some feedback we got was making sure we're really clear and direct on the client rights. So what I think is happening is we're trying to be client-friendly and then not use the jargon, but then we're missing some of the execution of the client rights. So just for context, those pieces. And then there's also the quality control that's happening around notices that get sent out, which again are not generated through Burleigh County. These are statewide notices. So I just think it's important to know that even though there's that performance improvement planning, it's not all just because of Burleigh County. We just happen to be the host of those reviews. And then those are done throughout the year, and they will host them at different locations when the federal partners come. Any questions on that part of it alone? Just... and then, like Grace said, really we're looking into the rest of the year and into the next year, focusing on that quality piece, making sure it's the balance of pushing the work items getting done and getting the benefits to the clients timely, but at the same time making sure it's done correctly so we don't cause any sort of hardship by maybe payment errors and issuing benefits that we're then trying to recoup. So really we're trying to drill down the quality of those. And then when Gray talks about dashboards, both her and Jeremy will talk about dashboards that have been created that they are able to go in and online and drill down through these dashboards per program, per worker, and it really is a helpful tool to monitor performance and quality. So I'm excited for both of them to have some live and action virtual tools that we can use to pull reports. They're still kind of getting used to operating the dashboards, and the dashboards are still kind of evolving as there's errors with any technology. It's like the data's not being pulled correctly, but I'm excited for them to have that as a resource. So.
Okay, I will continue. Another topic of discussion with FNS that came out was one on the narratives. Even though this was brought up by the FNS team, just keep in mind it does not only pertain to SNAP, but it does pertain to every program that we administer. The narrative is a documented record within our SPACES system, which describes every action that's taken on a case and by whom the action was taken. What they have found is many times these narratives are not detailed enough or they are missing altogether. All the workers across the state were recently assigned a mandatory training on March 13th, and this is due to be completed by March 31st. And there are still discussions currently on the narrative as far as creating a template or a guide for the workers to have in order for them to make sure that they are detailing all the important information that they want to be seen in the narratives. With Medicaid, so there's some changes that have happened in Medicaid, and this just still is extending from that post-public health emergency. The PHE unwind did begin in June of 2023, and over the next 12 months from then, as Medicaid cases completed their reviews, they were delinked from these PHE rules, and as of June 24th, once the PHE unwind was completed, Medicaid began counting the months of the unmet client shares. And we had counted this before prior to the PHE as well. Once a Medicaid case has not met their client share for 7 months, the Medicaid case will close. These closures did start happening January 1st of 2025 once the 7 months have elapsed. There was a mass notice that was mailed out, and they continue to mail out these to the households that will be closing for unmet client shares. This way, the household is able to contact us if they know that they will be having a medical need that will meet their client share prior to the case closing, and then we're able to override and keep their coverage open for that medical need. Also in Medicaid, we've started doing some outreach, and I think we kind of touched on this a little bit last time, but now we've been doing it for several months. We've been working with outreach with the North Dakota State Pen, and we are also going to be moving this to other correctional facilities here in the county as well. When a person is incarcerated, they are not eligible for Medicaid as their health care is covered by a state plan at that time. And so our monthly on-site visits that we've been doing is we've been having a couple of eligibility workers actually go to the pen, and they are offering their support with filling out the application to ensure that they have continuity of care upon their release, so that when they're released, we're able to get that Medicaid going as soon as they are released so they don't miss any prescriptions or anything they might need. For the LIHEAP program, the LIHEAP is moving to a year-round assistance, and this is going to include cooling assistance. The system is being updated each month in preparation for the change to the move to a review process, rather than the households having to reapply every October 1st. Normally, the season would end on May 31st, so moving to this review process is going to help keep LIHEAP open until the next review date. The review dates will be staggered, but is still yet to determine how the staggering will work. And then for child care and TANF, I do not have any updates to report other than that the TANF modernization project is still in the works, but it's getting very close to being completed.
Only other thing I had to add, Gray, was about the call center, and so I did print out, you guys have a one-pager that says Customer Support Center on one side, and then, on both sides of it, sorry. So it's front and back with the graph. So if you want to look at the side that's got the bar graph on it, we can talk about that one first. So this one just shows you the call center acceptance rates of the calls that are coming in. So mine, again, reminding you that this is a state-run call center, so this isn't a direct reflection of Burleigh County. We do have some employees who are employed through the call center, and then also those employees are around the state. So you can kind of see how the calls accepted are listed, and then the abandoned calls, those are calls that didn't get to. Typically, maybe that person, while they were on hold, decided they didn't want to be on hold, or the wait time was too long, or the call got dropped. So there's various reasons, but you can see when there's probably the highest part of that was December 2024. Question for you, Gray. So this call center was being ran with not only our employees, but we had in North Dakota contracted with another provider to implement some support staff in to help run the call center. When did that contract end again?
So the contract with the NRG employees that we're helping out ended in October.
Okay, that's what I was thinking. So since then...
I'm sorry, not NRG, Deloitte.
Yeah, that's okay.
Sorry.
So, and how many employees did we have through that Deloitte contract? Was that like 30 or?
I believe there were 25.
Okay. So what we're kind of doing then as a state is really looking at, since we lost those 25 employees, do we need to add more, right? Like that gave us a really good opportunity with that contract to onboard and train all our other zone staff, so that way they can take the calls at a larger rate, or they know how to answer the questions that are coming in. So now we're just kind of in this, I would say, monitoring phase where do we need to add more FTEs to this call center, or are we good where we're at, and what does that look like? So I'm not surprised then that after that time you do see maybe an increase in the abandoned calls, because maybe people were on a wait time that was a little bit longer as we adjusted. Which will bring me to, if you flip over to the other side, that will bring you to the line graph that shows you the wait time. So as you can see in some of our best time was in July and August and September. We were averaging, or June obviously was even better at 15 seconds on that wait time. And right now, we're averaging, you can see that by October, we were at 2 minutes, November, 7 minutes, and then it just kind of, our highest point was in January, we were at a 14-minute wait time, so. I just like to call this graph out to you guys because this is probably what I get most constituent concerns brought to my attention, and you guys in your roles may hear people talk about. If they talk about economic assistance, it probably has to do with our call center. Does anybody have any questions for Gray regarding her programming? Okay, thank you. Oh, I don't know why I did that. So before we get into the next one, I do want to call your attention to some other handouts that I gave, and I should have started with this, so I apologize. First, I gave you guys a packet that is has a little map of North Dakota on the front of it. It says our standards of administration, performance improvement, and progressive discipline related to human services delivered by the Human Service Zone. So essentially, part of this is that the department, Health and Human Services, when I refer to them as the department, had to establish standards for administration for zones. And then these standards are made to assure that all parties have a shared understanding of what successful performance is and who serves as the any determination of a failure to administer if we fail to meet. So I won't read you all the century code that's listed in that, but it's as board members, good education for what we're operating in. It kind of goes into what the different standards mean, different tiers of measurement, performance outcomes, and what results from failed performances. So measure 1, we are measured on cases in our, when we refer to FRAME, it's just our documenting system and child welfare. They have to be tardy-free of transaction error. So what that means is that we have a time limit of 30 days to open and close the cases. So when a child enters care, we have 30 days to register that, or when they exit, we also have 30 days. So they just want to make sure we're doing that timely. That one is pretty much a pass or fail. It's 100% expectance to meet that standard. So if a case closes and the case manager doesn't go in and close the case within that 30 days, we do not meet that one. Measure 2 is at least 95% of children in foster care will have an in-person caseworker visit every full month that they are in foster care. These are in-person visits, policy outlines for our case managers, whether or not they need to, what's the requirement for being in the foster home or in the community. So there is policy that defines that they can be done in the home, they can be done in the community with the foster provider. Let's say they have an activity for the kids and they'd like us to meet them there. We can make those accommodations. We also have the ability to view the children here at the county office when they're doing visits. And then there's a special carve out in policy when children are on a trial home visit with their parents, where then our focus is seeing the children in that home as we transition them back to their biological home. So again, 95% that we want to see those children for face-to-faces. So we that's that measure. Measure 3 is 95% of children in-home kinship foster care services receive in-person visits with their case manager. Notice that this one is twice a month. So when we are open in-home services versus where we're the custodian, it's double. We have to see them 2 times a month in their home. This one has a different set of challenges. I'd say a lot of times when we're doing in-home, we're working least restrictive to place children with relatives. So we often see where these kids could be living with a relative in Pheasant, North Dakota. And so now not only do we have to make plans to see them once, it's twice. And so it's just a little bit more of a barrier. We're seeing more kids placed outside the Bismarck area with our kinship foster care or in-home services. Measure 4 is at least 88% of CPS assessments will be completed within the parameters by policy. So basically timelines for in policy lays that out that you have 62 days to complete the assessment. This excludes any extensions granted that are described in policy. So we get extensions on cases. I have a new CPS report. I have 62 days to complete the assessment in its entirety and make the finding and notify the family unless, and some of those unlesses are typically driven by law enforcement, like we are pending forensic interviews, there's an investigation going on, so then we can have reasons to extend those. So that's 88% of those have to be within that timeline. Measure 5 is at least 90% of initial responses for face-to-face contact with children are in according to the state policy. So this, again, is your CPS assessment. I get assigned a report of abuse or neglect, and I have timelines to complete my face-to-face with the victim and the other children. So you have different categories. You have A, B, and C categories. A, time response is 24 hours or immediate. Is the goal that we shoot for. B is the 3 days, the 72 hours, and then C is within 14 days. Those categories are driven in policy based on what they are. Obviously, A's are more serious physical abuse or sexual abuse, those kind of things, are more vulnerable children, and then B's and C's kind of tier off depending on the allegation, which I could go into detail with at a later meeting if somebody wanted to know all those ones. But yeah, so that's 90% of compliance that we have to get on those. Measure 6 is eligibility. Team members are completing at least 80% of the total number of work items each month. So those first 5 measures are driven by Jeremy and his team in child welfare and using their dashboard. And then Gray is responsible really for measure 6 and 7. So this one is the 80% total of work items each month, and then 7 is 95% of applications are reviewed and processed by federal timeliness standards. So I'm going to pause at that point because it's a lot of information, and again, it's a big handout that you guys can look over. There is a measure 8, which is about our monthly budget, and then there's a measure 9, which is about our personnel changes report. Those ones between myself and the business manager, we look at those two in compliance. So those ones aren't meeting those compliances, don't have as many other people involved in them. I guess they're just really one time a month submissions that are managed and submitted. So what I'm trying to say is more likely that we're in compliance in those two, where all the other measurements we rely on other team members to do their part. The last page of this handout, which is regarding department practices related to performance improvement and progressive discipline relating to this. So when zones are scored on these, they have the option of getting exceed standards, meet standards, failure to meet, severe failure to meet, and chronic failure to meet. There's a whole process that goes into documenting each quarter where each one of these metrics falls, and then there are performance disciplinary actions that come depending on where I land as, again, kind of at the helm of the agency. So there is direction throughout here that if a director were to get so many chronic failure to meet, what does that mean? Actions can include targeted training, corrective action plans, performance improvement planning, or structural realignment of the agency. So just things to keep in mind as you get these. I bring this to your attention. These were kind of implemented about this time last year. We started as zones having this conversation on creating these standards. We've spent the probably the last couple quarters just fine tuning them and deciding, is this what we want to measure? Are these the percentages we want to measure? And is the dashboard pulling the information correctly? Some of that is still a work in progress. I'll tell you that my in-home face-to-faces, it's still a data entry thing. I think it's still us understanding when we go into the system that we're coding things right, so we pull the data. So some of it is still in the works, but the goal is that after this current quarter, January, February, March, so at the end of March, they'll pull the data, and then the zone boards will all get my report of what the zone is completing. So I wanted to kind of give you guys a baseline on these standards so you could get familiar with them, because going forward at our meetings, we will be reviewing the zone updates and these reports. So the other packet that goes with it is the other stapled item, which we can look at, is my October, November, December report. So you can see on this one, tardy transaction errors. This is that one with the opening and closing of the cases in a timely manner. Again, that goal to meet that is 100% accuracy, and we finished that quarter with an 85.7%. So on that one, I get categorized in the severe failure to meet on that one. Again, that's just a data entry standard. We are working, it should be an easy fix. I think it's just getting people in the rhythm of time management, task organization, understanding that in all of their day and the crises that are in front of them, these things still matter, and they need to make sure they're getting this part done. So that's one we will work on. One of the ones that I think are more important would be Measure 2, the visits with the children in foster care. We scored at the meet standards with a 94.6%. And again, reminding you that that one required at least a 95% for the exceed standards status. Visits with children in home foster care, that one, we were at a 65.3%, but again, that we're not entering that information correctly and coding it right is a big issue with that one. So I'm hoping that when you guys get to look at the next quarter, the January, February, March quarter, you'll see much better numbers on that. Our CPS timeliness one, that one, we were at the 65.9%. So that one, we failed to meet on that one. So, again, we're just working on prioritizing how do we get those assessments completed timely, or do we have the right information in the system regarding the reasons why they're being extended. CPS face-to-face timeliness is another, between number 2 and number 5, that really is where we focus, because that's just laying the eyes on the children who are the victims of the maltreatment and the kids in foster care. So they are, and then along with the in-home one. So that one, we got 86.6%, so we had to meet standards on that. And then the 2 economic assistance related measures, we received to meet standards on those with an 83.9 in work item processing volume and a 99.1 in processing timelines. So kudos to Gray and her team, that those are great numbers. And I have zero concern that they will continue to get those ones. Any question, comment, concerns, feedback on this process?
Just a question, going back to the progressive discipline. I know that's obviously a topic that can come up, and just to help with supervisors and obviously employees, but the standards here, exceed standards, meets, failure, severe, chronic, are they defined?
Yes, I want to say on the front of your packet, and those couple pages I probably cruised by, I think those are defined up there.
I didn't see.
Maybe not in here.
I was wondering.
Oh, I'm sorry. So those are, they're kind of defined within each measure. So like, let's say you just look at measure number 5. At the bottom, there's that yellow box that says status and standards. So exceed standards is 95 to 100%.
Sure.
Yeah. And then that's why I won't read them all to you, but each
Okay.
measure really goes into what's the federal threshold. This is really explaining to you guys, like, why is this important? What's the fiscal penalty of these measures? Where is this information being pulled from? Why does this matter? Measure
Okay,
matter?
I'm tracking you.
Yeah. The corrective action planning and progressive discipline that would happen would be on me as the director of this agency. So again, it's just another piece of accountability to ensure that if I'm failing these measures, I have the responsibility to then turn to my program managers and say, how do we drill this down? How do we offer support? How do we advocate for the workforce, or what do we need to do different? And then again, their accountability to turn around and deliver that to their team. So this really, I have no issue with this. I actually am very happy to have these, because we take a lot of great pride in Burleigh County for the work that we do. I think we do a really good job in Burleigh County. And so I think for years, we've been looking for something like this to help standardize that same accountability and performance expectation for all 19 human service zones. So I have not a lot of sweat going on about if we'll meet this or what that'll look like. It just gives me opportunities to look at areas that we might need to advocate for more staff, if that's the case, for getting out to some of these reports or processing some of these work items. So, and at the same time, then helps me understand where I need to provide more training.
Does every zone, I apologize.
Yep.
Does every zone use this?
Yes.
Or is this just Burleigh County?
Nope. Yep. Good question. So every zone, this is all issued by the department. Every zone will get their quarterly report to their board. That's what's new, is that it'll go to their board. Because again, we spent the last year probably fine tuning it. So now it'll go live to our boards. I did ask if there is a way, or not just me, I guess another zone director asked if there's a way to get a comparison from zone to zone. Not that you need their detailed report, but just a simple visual aid to show you where I am or where we land as Burleigh County compared to other zones. So I am hoping that you will get screenshots of that. Yeah. Again, for my own accountability, so you can look at it and tell me where I need to pick it up at and give kudos where kudos need to be given. So, yeah, I just think I just wanted you guys to have those, kind of get familiar with them. They are something you'll start to look at. And I hope that you find them helpful to see where we're landing. Okay, now that I explained those, it'll help put in context some things Jeremy's going to go over in his program of child welfare. So thanks, Jeremy, for letting me pivot you there on your agenda.
All right, thank you. I'm going to start off with kind of some things that we're working with the state here first. Right now, the state is going through kind of a case management redesign. They're looking at how processes are occurring and policy is occurring with case management. So they're partnering between the state and other human service zones in work streams. So there's 5 work streams right now happening. One is engagement, which is developing training and standardizing workforce support. The other is supervision. Creating supervision is the playbook and structured supervisor training. Case movement, how we align case processes going from in-home to foster care and back to in-home. And safety framework, measuring and improving implementation consistency, and then connection to support, streamlining services access for families. So those are the 5 work streams that are happening right now between the zones and the state on trying to redesign the case management system. Right, and we have 3 staff, so our zone director is on the supervision work stream, and then we have a case manager supervisor that's also on the supervision work stream. And then we have a case manager that's on the safety framework work stream. So we have 3 staff that represent Burleigh County, in the zones for this case management redesign. The state just put out a survey to all of the case management staff and the supervisors and the zone directors probably about 2 weeks ago. And the deadline, I believe, is tomorrow for all the staff to respond to the survey. And really, it's given everybody the chance to have a say in what policy is right and what policy may not be right and what processes might happen and how do we streamline processes a little bit better. Maybe getting rid of some of the documentation that is required, things like that. Our biggest hope here at Burleigh County Human Service Zone is to try to gain that guidance and caseload standards. Our caseload standards right now are extremely high compared to a lot of other zones, and that is going to effectively tell us, do we increase our workforce or not? Currently, like I said, we're way above even the other bigger zones, which is Cass County, Ward County, and Grand Forks County. Just had a meeting with the state case management lead, and she said our amount of foster care children that we have right now is at the highest it ever has been right now compared to the other zones, and we are really working really hard on trying to keep that smaller, but also manage it by our case management, right?
Jeremy, if I can add just before going to the next topic. So the work stream that I'm in is the supervision playbook. And so I will tell you the biggest thing we're looking at is what's a good use of a supervisor's time? How are you an effective supervisor? What pulls you away from giving the time and attention to supervision? Obviously, a lot of times it's searching for placements for our kids that are coming in, responding to crises that are coming up, having to go out in the field with your team members as we train and onboard new team members and we deal with turnover. So looking at that, what can be taken off their plate, or how do they have their own time that they can be using for what we refer to as blue light, which is just protected time that they can just concentrate and work on things they need to do, more the reviewing of documents and affidavits. Part of the challenge on me or that I'm posed with is looking at what I can take off of them that is more administrative. So how can I help them do their job more efficiently? And so that's been a really good work group. Other thing I'd say about this redesign is when it kicked off, it really was looking at those case managers on what is a successful case? What does success mean to you? What do you think really helps get these children back home and reunification and supporting families? And honestly, a lot of the times it's that rolling up your sleeves and doing that work, like, you know, getting them into their appointments, getting them into their housing, providing them that education. So we need to shift focus on how do we get them to do that work versus what is taking up their time in a time study, which in Burleigh County is a lot of transporting and visits. We're spending a lot of time transporting children to and from school or to and from appointments, transporting parents to those things. And so also really valuable time. We have a lot of good quality time that happens in those cars, but it's probably not where their work should be focused. So that's what I'd add to that one. And then just regarding the caseload standards, I also sit in on committee that reviews addition of FTEs or full-time equivalents to zones. And so if I want to ask for another position, I go to this committee and then they get to kind of mull it over and decide if this is supported. Some of the challenges in asking for new positions is we all kind of have onboarding fatigue. We've had so much turnover that if I looked at my case management team and said I could get you another case manager, I think a lot of them are like, I'd rather just take a couple more cases. So it's kind of a balance. We just need to get them stable and get them onboarded, and then look at adding FTEs. Another challenge is sometimes these cases ebb and flow. There could be quarters where I think I need another FTE, and then quarters where things go down and we can manage. So just more saying that for clarity around, like, we're aware that we need more support and that we need better caseloads. It's just developing those standards, though. Other zones could say a caseload ratio of 1 worker for 10 cases is max for them because they live in rural areas. They might be traveling across large counties to go do these face-to-faces and see these kids. So that's not a barrier that we have here in Burleigh County. So there's a lot of variables that go into the caseload determination. So Jeremy's been working with his team to develop more of a weighted system where we try to focus more on the needs of the case. So if I'm a case manager and I have 13 cases, that could be the equivalent to somebody who has 23 just based on the needs of that case. So we've talked before about that in this meeting, and going forward, weighted caseloads we're hoping will be part of redesign. Okay, thanks, Jeremy.
Thank you. All right, going on to CPS, our Child Protection Services, and staffing updates. I think you got the February report. For the month of February, we received 199 reports of abuse and neglect. Out of those 199 reports that came in from intake, 153 of them turned into full CPS assessments, meaning our CPS workers, and they received the A, B, C category reports. Then they have those 62 days to complete those full assessments, and we received 153 CPS assessments for the month of February. In the month of February, we had 321 active CPS assessments, with 98 of them new and 90 closed. So that's way above average of what we normally receive, between receiving the reports from the community members, stakeholders, mandated reporters, and so forth. And due to the amount of continuing growing of the reports that come in, we managed to successfully be approved for a new full-time position. So right now I have that offer out, and hopefully we can finalize that offer and gain an extra CPS worker for our CPS program. And then I also have, and I'm working right now with the CPS supervisors on how do we streamline the process between CPS and case management, because during the CPS assessments, their main job, is the safety of that child and assessing whether maltreatment did happen or not. And then we have case management if they see a need to provide that case management, those resources at times when it does come overly abundant and clear. So then the referral comes from CPS section over to case management. But there's a transition period that happens in the middle there that sometimes a lot less work is happening for case management. So I'm trying to streamline how that works when CPS ends up referring case management. So in the year 2024, there were 1,435 reports that we received from the community members, whether it's kinship, family members, or if it's mandated reporters. We received 1,435 960s, what we call, for maltreatment. Out of those 1,435 reports, only 83 CPS assessments turned into in-home case management, and 53 CPS assessments turned into foster care case management services. So to give you a perspective, only 6% of our assessments were referred into in-home case management, and then 4% of CPS assessments turned into foster care case management. So moving on to foster care then, and the licensing, some of the licensing data. Just to give you a current count right now, because I think I gave you March counts or February counts. Today we have approximately 270 kids, 207 youth in foster care for Burleigh County. Of those 207 youth that are currently in foster care, 42 of them have parental right terminations, which means they are adoptable now, and they can find that forever home with a family. And I want to compare this number of 207 youth in foster care right now compared to exactly today in March 2024. We had 156 foster care children. So a big difference between last March 2024, 156 kids as of today's date type thing, and now we have 207 kids. So we do have a larger caseload for almost the same amount of staff we have.
Jeremy, if I can add, so I did get you guys a visual. Like Jeremy said, we had a meeting this morning with the department to talk about different things, complicated cases that we work related to different needs of the children, but we did look and talk about that. And so the handout that's got some charts on it, that's in green. So this one you're going to see that first one with the line graph. So the darker green one is the kids entering in care. This is a really nice visual to show you kind of where we ebbed and flowed. Obviously, November and January, very busy months. We took lots of kids into care. I think we were saying from November to February was like 80 kids throughout that time that came into care. Some of these children, we've also been able to, then the light green one underneath it is the children who are exiting care. They're either being reunified with their families, or we're getting permanency through guardianship, adoption, or they could be aging out of care. So what we would like is to have those lines be a lot more aligned like they are in February, with the same number of children coming in, just kind of exiting, to keep our numbers a little bit more consistent. Obviously, ultimately, we would like to see kids exiting and not kids coming in. But so you will see where we had our peak areas. I will tell you that we've been challenged on the why. Child welfare isn't something you go looking for business in, but there are things that happen. There are trends in your community, whether that means there is more emphasis being put into certain areas of like home conditions when we're going out. But we are being looked at like, is our level of intrusion the appropriate level? And so I just always remind everybody, like, our case, we don't take custody of children. We're given custody of children through the law enforcement, the courts, and we always answer to the courts. So we're taking these cases before the courts, and we have to prove why these children should remain in care. So there are checks and balances in place, but our numbers have significantly increased. The next box, you're going to see percentage of foster care entry identified as Native American. They typically drill down that because that is a population that we see a lot of in Burleigh County just due to our location. And so you'll kind of see how that trend went. I think that speaks to some of the idea of one of the last boxes, foster care exit by zone. That one, like Jeremy said, we get usually compared to those other three big zones, Cass County, Grand Forks, and Ward County. We have a lower exit by zone. Sometimes I do look at, depending on the demographics of those that we're serving, there's just more that goes into the reunification efforts that we're working with our Native American youth and trying to make sure that we're doing those active efforts with those families. You also have the tribal liaisons that are involved in those cases that are supporting us with those cases. So they tend to linger a little bit longer. And then, yeah, you'll see the foster care entry by zone, Cass, Burleigh, Grand Forks, and Ward County compared to us. So I just thought that was a good visual aid to kind of just draw your attention to. I think when you look at one of the other documents you're given with some different graphing on it, you'll see that our in-home cases took a big dip. I think what that means is those, if you compared them, they're about the same time that our foster care cases took a big spike. So what I will say is kudos to our team for their active efforts. We are typically praised for those efforts that we do through family-centered engagement meetings, trying to engage families to prevent entry in foster care. We utilize other prevention programs like a shelter care program where we can have children go into a foster home without coming into custody for a 14-day period while we try to work with the family, identify supports for them. We're one of the biggest zones for utilizing those programs. So what I'm getting at is we're throwing everything in the kitchen sink at these things to be prevention before they're just entering into foster care. So I think that data shows that. You'll see that our in-home was up, and then when in-home drops down, it's because those kids are now converting into foster care programming. Yeah, go ahead.
I guess I have a question. Throughout that time then, that 199 people that are individuals, kiddos, that entered in, are they in then the foster care program? Or are they still in home in those 62 days while you're trying to decide the results of that assessment?
So the 199 reports? That come-
Correct.
Most of the time, they're still at home. Like I said, only 6% turn into in-home case management, which it could be a relative placement, or 4% turn into foster care. But most of the time, they are in the homes while we do the assessment with extra supports. Maybe we might have a grandma or an uncle and aunt that would be part of the plan. You know, we have present danger plans and we have safety plans that we create in CPS for those 199 reports. During that time, assessment happens, and we try to find safety supports or natural supports to help the current family out while we're assessing.
Yeah, I think that's a good question, and I think what we could do, Kelly's, and or maybe our next meeting, we could ask team member or a supervisor to maybe come in and give a brief overview to this board about how that process works, because we have had some changes to either the safety framework or new board members, just to give a quick view of when a report comes in, how that's moved through what we refer to in our language as the danger threshold. Does danger exist in this family, or is there likelihood that maltreatment is going to continue? And then how we determine the level of intervention we're going to take when Jeremy talks about safety planning, to the highest level of intervention being custody and foster care. So I think that would be a good point, because not all CPS assessments result in any sort of case management. And then there's a percentage that goes to in-home, and then there's the percentage that goes to foster care. So I think that'd be helpful to have. Yeah. I just always like to bring the people who are really close to the work so you guys can hear way more firsthand how it's done.
Talking about prevention efforts that we try out, right now we have 38 families working in in-home services. Like Chelsea pointed out that, it's lower than what it was a month ago, but we still are at the highest point compared to other zones across the state. And then there's 63 families that are currently working with parent aid services. So parent aid services are supports that we bring parent aids into the homes and working with the bio parents to help out on various skill activities, whether it's habilitating them or rehabilitating them, trying to learn a certain skill, parenting skill, something like that. So we have 63 families that we work with and 4 parent aids that provide that service. For licensed foster care providers, they remain stable right now. 55% of the homes having at least one open bed for placement. Sometimes that is still a challenge because they can say no, even if they have an open bed. So we do a lot of calling around. Our case managers do a lot of calling and trying to identify a foster care provider to take one child, sometimes 5 children in. And then the number of certified kinship providers has been increasing, with 73% of the providers now offering respite care for families. And then the foster care homes, they're shifting towards more of a relative-based placements and fewer long-term residential care settings. So they're really active. We, as zones, and work with the state on actively trying to identify relative placements before we even try to find a foster care provider placement. And then we sometimes work on trying to get them licensed as foster care providers so they can get the resources that other foster care providers get too. And due to our very, very high case loads for case management services, we do know that there are times when our foster care providers may have some feedback, and based on various times with our case management working with them. So our management team has identified that we want to start kind of reaching out as managers to talk to these foster care providers and listen to their feedback and concerns and see if we can find solutions to those feedback when we get it. And then Kinship North Dakota Support and Reimbursement. Kinship North Dakota offers financial assistance to caregivers providing full-time care for children. The reimbursement program offers up to $800 per child with receipts required. Allowance programs, monthly support, so they also would receive $29 to $36 a day, up to 6 months, depending on the ages of the children. And then they also provide guardianship assistance up to $2,500 for the legal fees, since that can be quite expensive for family members to take on guardianships. The only thing that the eligibility criteria it requires is that person has to have a pre-existing relationship with that child already. If that person does not have a pre-existing relationship with that child, then they would not be qualified as a kinship for supports and reimbursement.
Yeah, I'd say kinship has really expanded to where we can consider teachers from their school, coaches, people from their churches. So that's been really helpful to expand what is considered kinship in North Dakota and think outside the box with safety planning, keeping children with people they're familiar with versus them entering the foster care system. I'd say the biggest thing in this area that I focus on is this guardianship assistance, the up to $2,500 for legal fees. So these are when it's not contested. So parents are fine with this, and grandma wants to have the guardianship of these children, so we don't need to be involved, whether through in-home services or as the custodian. So when you're talking about through in-home services, we're not the custodian, and so we're really working hard to make somebody that legal decision maker through this guardianship. But if it's contested by the parent, we end up where some of these times these legal fees are not supported. And so we've been working with the department to identify a large number of our cases are falling in that group where we are really involved with this family just to try to keep things in order and support the family, but we don't have somebody who can make these decisions for the kids outside the parents, and the parents are contesting it, but we may feel like there needs to be additional support for that family. So we did work with the department on creating an RFP for some support for legal, some attorneys who can help process these cases statewide, because we try not to tap into our state's attorney for these, because again, with the number of kids that we've seen increase since 2024, that's a lot on that one state's attorney. And then also, when we're not the actual custodian and we're doing a guardianship, what happens is the court expects us to come back before them either 3 or 5 or so years later, and we may not be involved. And so it just puts us in a place where we're not the right people to be ordered to those hearings. So yeah, I would say guardianship is a big topic for us in our agency, and just how do we get guardianship for these children so they can have that permanency and we don't have to be involved with the family. So.
Okay. Moving on to community engagement and the collaboration. So right now we're really strengthening our partnerships with the Ask, which is an adoption service that we work with, and then juvenile courts, and then the Bismarck Public School System, where we meet monthly with all 3 of those entities, along with other stakeholders too. We have a lot of stakeholders in this community, but those are the 3 major stakeholders that we really work with, other than law enforcement. We're currently working on and looking at a new evidence-based practice. I know I've talked about this in the past. We still continue to work with the state in trying to identify a good evidence-based practice for our parent aides to work with our parents. That's called a family checkup, if you ever want to look into that. And then we also are working right now collaboratively with UND, University of North Dakota, and the Native American Training Institute, also known as NATI. So if you hear NATI, that's the Native American Training Institute. Those 2 entities are collaborating with us on looking at how do we improve services for Native American families and those children in this community. And we met a couple weeks ago, and our latest efforts were identifying external stakeholders that might be interested in being part of this group, this work group that we have. So we've identified some individuals, but if you guys know of anybody that might be interested in working that, please let us know. And we also worked with the Children's Advocacy Center. So our CPS supervisor, one of our CPS supervisors, is currently part of a training onboarding system for the Children's Advocacy Center for as they do the interviews for child abuse and whether it's physical abuse or sexual abuse.
The only thing I'd add to that one is really we were trying to create like an onboarding for the MDT, so that way the advocacy center could have a team that's going to train either new child welfare workers, new law enforcement, new state's attorney on what all of us do. So kind of put together as the cases flow through from the moment a report's received to how we get to the point of a forensic interview, and then how do we, what happens next. So it's been, we're just kind of creating like it's a quarterly training for those professionals to be able to go through and participate. And it's been, I think they've had 1 training so far, so.
Yep, 1. All right, and I want to go on to the Dandelion Award recognition. So the state Child and Family Services developed a award recognition system for human service zone employees, and it's called the Dandelion Award. And the Dandelion Award recognizes the child welfare professionals who show the resilience, dedication, and strong commitment to supporting the kids and family members. Why they call it the Dandelion Award, it's kind of inspired by the idea of dandelion children who can thrive anywhere. So they started this award back in 2023. Recently, we had a Burleigh County staff member receive their award in January of 2025. And then in 2024, we have had 3 staff recognized for the Dandelion Award. And then in 2023, the first recipient of the Dandelion Award was from Burleigh County. So we've got five staff that have received that Dandelion Award recognized by the state. And that's all I have. So any questions for me or?
Jeremy, just a reminder, how many parent aid positions do you have?
We have 4 parent aides, and then we have a parent aid lead that supervises those 4.
Yeah, I'd say ideally, my parent aides, I like it when I see them working directly with the families. They're in the visits with the families. They're supervising those visits. They're providing coaching and education during those visits. They're being able to incorporate the case plan that the case manager has put together into smaller goals, providing redirection, education based on the developmental needs of the children, going into the home as we transition into trial home visits and answering questions for them, showing up during peak times like morning when it's chaotic and their mom's trying to get and mom and dad are getting everybody ready for school, and that's what we like to see them doing. Unfortunately, a lot of times we're doing transports, and so they're spending a lot of time of they really are a critical piece in that case manager's work. The case manager is the one who helps decide what services should be put into place and how is this really going to work for reunification, engaging with that family member, and then they rely on the parent aid to get those things done and actually get them accomplished. So
Do you know how does that compare to Cass and Grand Forks and Ward County?
Good
Is that
question.
pretty comparable?
Yeah, good question. It just varies. It's so hard. I am hoping redesign helps us get more standards, but it's hard because some zones maybe don't use parent aids and they have things what they call a case aid. Or some zones don't use parent aids and they just have less cases per ratio of case manager than case manager. So it's all kind of done how you structure it by zone. So to give you a comparison of ratio is really hard. But I can give you some numbers that we got today. So for Burleigh County, like Jeremy said, we were at like 207 for number of youth in foster care, which again is a huge jump just in the last 4 months. We've been very busy, let alone in the last year. And then the next highest would be Cass County at 161. And then Grand Forks was at 112. And then Ward County was at 103. And so Cass County being the highest population, having over 40 less children than we do have in care. Again, we try to work with the department on what is the why. I will just be honest that we know our community. We know the standards that we have in our community for what is safety for our children. We have very active schools with engaging these parents in everything from educational neglect to meeting the needs of the children through backpack and food programs, through doing visits into the home. And so we have a lot of eyes on these families that we are able to probably identify maltreatments that are occurring, and then we are able as a zone to respond to those. So,
Yeah, I would say talking to the other program administrators, I guess in Minot, Grand Forks, and Fargo, I think we have the best relationships with our public school system. So kudos to the public school system here.
any other questions for Jeremy on that? Thank you. Okay, next up, I had other zone updates. Really, we've just been hands-on in both those program updates that you guys have received, so I don't have a whole lot of other zone updates to provide. I think the biggest thing that outside of that I've been spending my time doing has been the legislative session and different bills that we're working on. So some of the ones that I think are critical to the work we're doing are, there was a House Bill 1564, which was related to the Indian Child Welfare Act. So that just, again, was making some, was really adopting that federal into our North Dakota law around that. So practices we're already doing, best practices for child welfare. So that's one that we have been supporting as zone directors. I should say that when we take a position to oppose or support, it's on behalf of all 19 zones. So I don't just decide what is best for Burleigh County. It's on behalf of all of us zones. There was additional conversation around House Bill 1268, which was related to the drug testing of parents when children are in foster care and the compliance with that prior to reunification. So our position on that initially was in opposition, based on the fact that drug testing is a tool that we already have in our toolbox as zones. So we could choose to engage with families on that. But really our position is that when we're working with families, we try not to be so compliance-based, and we really want to look at changing of the behaviors. We want to have understanding that relapses are likely to occur. And so how are we building the capacities and skills in parents for if a relapse occurred, how would they make better decisions? Who would they reach out to? Building those safety nets around the substance exposure, and not just, you pass this drug test and then you're able to have your child. So we're really trying to look at it through a much more like kind of macro approach. Not saying that we don't do that. A lot of times families are already engaging with whether it's treatment programs or maybe their parole and probation programs where those drug testing are happening. That is just restricted information that provider may not know. So our position on it was more just an opposition in a general, like we don't want to go to a compliance-based, get a driver's license, get a home, pass a drug test, and the child goes home. We really try to focus on motivational interviewing and changing of the behavior. So, but what we were open to was really fine tuning our policy and procedure around that idea. So we have been working with the department on, and the sponsors of the bill regarding the policy around that and how can we as zones be more consistent. Yeah, those are kind of two that we've probably really been following and providing testimony to. I don't know if anybody has any questions on that or anything to add on any other bills. Okay. Okay, next on the agenda would be public comment. And thank you, Commissioner, for your patience.
Chair and board members, actually, I listen to all these meetings, so I'd have been listening to it at some point. But I'm a little too late each day, so I'm keeping up with session too. I just wanted to make everybody here aware, stakeholders in the Metropolitan Planning Organization, which does include Lincoln, and anybody that has connections with University of Mary or Mandan. Bismarck, we have formed a steering committee in relation to the sales tax being voted on and passed by the voters. And a big portion that is we now have funding source for public transportation that's not related to our general fund. It's 0.2 cents of sales tax, and it truly changes the conversation because there's a lot of things we currently do with, say, like transit opportunities and things out there, but we can open up the conversation even to a broader spectrum. So we're really seeking what are the needs. It's really about protecting the ride, helping people get from point A to point B if they don't have like an automobile or whatnot, or their health puts them in a position to where they can't utilize a regular transportation source. So on May 8th in this room, 6 p.m., we're teaming up with the Human Relations Committee, And from 6 to 8 p.m., we're inviting anybody to come and tell us what they see in the community, and we'll see if we can wrap a plan around it and grow into the future in a more connective way, I guess would be the term. And then also, anytime in between now and then, our steering committee is going to meet probably a minimum of 4 times, maybe more. We start collecting those revenues April 1st, and it'll be ongoing into next year. But any ideas can be also submitted through to our Bismarck administration. As we come out, Mandan has a separate measure. They're working on it in their own way. So there's some interesting things. And we don't know all of the problems out there, or challenges, or opportunities. So we're really relying, and we're just getting the word out to as many places. And anybody can always call me too. So, but if you have any questions, feel free.
I do. So this Human Relations Committee, is this just for Burleigh County? When you say Mandan's also working on their own thing, are you guys communicate between the two of you?
The MPO functions in Mandan, Bismarck, Lincoln, and University of Mary, where the routes are. Currently, 75% of Burleigh County is the Bismarck city limits, and I don't know if you add Lincoln and University of Mary, if that ticks up towards that 80%. But once people are in town, say if they come from those outer limits of Burleigh County and things, they can certainly use like the CAT bus and but maybe some of those other opportunities. Well, we might not even know what this could turn into. It's a huge opportunity because like say, for instance, in the case of transit, they were bleeding reserves and they were going to be out of money next year. So we're in a position to answer that particular part of the conversation, but we're also in a position to look at other things beyond that. We have the best swing now for probably 1 or 2, but as those resources start getting utilized, that'll get harder because once you have some of those things in place. Some of the thoughts as far as things that we've talked about already is we have the schools are going to be at Friday's meeting for our steering committee, and the public's invited to that too. It's in this room. I believe that's at 10 a.m. So we're talking to the schools because we compete for drivers with the school district. So is there a way that we can meld some resources so we can they can meet their needs and we can meet ours? Back up on 7th Street at Q&R Clinic has been a concern for years. Can we alleviate that for the safety of the community? But I know the one example that I shared with you, Chelsea, before is there was one of the people in the foster system to where they were healthiest because they got healthy here in Bismarck, but they were living in a different jurisdiction because they became an adult. So they actually had to pay for their ride. They used all of their money from their job to get from point A to point B to try to graduate. Well, she actually helped us get the initiated measure forward and told her, well, this won't be an answer for you, but maybe you could help provide the answer for the next person that struggled the same way you did. It's kind of some of those things. Any other questions? All right.
Thank you. Okay, seeing no other public comment. Next on the agenda is other business. I don't have anything else to add. I've said everything I think I need to say on behalf of the zone. So did anybody have any comments, questions, things they want to see from this board? I think this works nice to have the program administrators give their updates. And then I do think it'd be nice if we could give a next meeting just a little kind of walkthrough of the safety framework and that level of intrusion. Okay. Otherwise, if there's nothing else, then last thing on the agenda is to adjourn the meeting. So thank you and meeting adjourned.